Session we talked about the EEG. This afternoon we're going to talk about how do you do an EEG. To do an EEG you require a few things. One of the most important one is what you call the amplifier. In the old days you used to call it the head box. Technically speaking, this is the whole EEG machine. This amplifier is connected to a computer, but it is this amplifier that picks the activity and it uses that activity to generate a waveform that is displayed on the computer. You need electrodes. These are wires, we call them electrodes, and they are connected to the amplifier. And these electrodes are the ones that are connected to the head. And when they are connected to the head, we use a certain gel, which is a conductive gel. This one is called 1020 gel. There could be other types of gels. We also have another gel called Nuprep. We use this for cleaning the skin to remove any dirt from the skin or safeguarding tissue. We use this little stick, call it Q stick, to clean the skin so that we can have good contact. Now, we use about 21 pieces of wires distributed around the head. And this is not done randomly. We measure the head so that you can identify which particular positions we need to use to place our electrodes on. Now, some places where the skin is not having hair, we can use a type of tape. It can be either a small micropore tape, or it could be hyperfix, or any other type of tape that can hold. So to recap, we have a cleaning gel, we have a conducting gel, we have the tape, and we have the electrode. Once they are all placed on the head, I'll just show you an example of one or two. I've got my tape ready, and I would have my gel ready. Normally you'd have all the gel in one place, but because I'm only using one, I like to just use a little bit of it. You clean the skin, just not very briskly, but firmly. And you take the piece of electrode that you're using, with a little bit of conducting gel, and use your tape, and then you place that electrode where you have cleaned, just gently. Now, some people, once you put that, they might feel a little bit itchy on the spot where you put the electrode, but that's temporary. It's not long lasting. However, should somebody complain of severe pain, it may be that they are allergic to the gel and should be removed. The electrode should be removed immediately. Now, there are 23 electrodes, 21 electrodes, as I said, distributed in the head. The front part is the frontal pole. We have the occipital area, we have the temporals on the side, and the central. When they're all placed in the right position, you tie them back together very neatly, and then the patient will lie on the bed for about 20 minutes as you take the EEG. Sometimes, in some patients, we ask them to take some deep breaths for about 3 minutes, and also, in some patients, we ask them to look at a bright flashing light. We call it photic stimulation, which are both useful tests for specific types of procedures. Next time, we'll talk about why do we do an EEG. Thank you to my patient.